Hey there, Davin Lim, Dermatologist. So today we'll be talking about female pattern hair loss, in particular genetic or androgenetic alopecia, or in other words, AGA. Now, this condition is much more common in men because of the hormones we have, in particular testosterone to dihydrotestosterone. Females do suffer female pattern baldness. So how can dermatologists help? Basically, what we do is to exclude other causes of hair loss. And common causes include telogen effluvium, which can be secondary to things like viral illnesses, blood loss, or any shock to the system. Generally speaking, that form of hair loss self-corrects within 3 to 6 months. There are a few nutritional factors that should be considered, including iron deficiency anemia, thyroid problems, as well as B12 or folate deficiencies. Certainly other rare causes include zinc deficiency, but that's the exception rather than the rule. So from there, your dermatologist will investigate, including some blood tests to exclude other causes. Now, from there, you've got a few options. The first and simplest is Minoxidil. And Minoxidil basically can be used topically between 2 to 5%. Most dermatologists choose 5%, and to be used twice a day. Another solution is to use Minoxidil orally, and the oral dose varies between 0.5 milligrams to 2 milligrams taken daily. From there, we can add second-line treatments, and your dermatologist will discuss a simple anti-androgen known as spironolactone. So this tablet has been with us for many years. It is used as an antihypertensive, in other words, a tablet to control blood pressure. However, dermatologists have found that it's a very potent anti-hormone. And the range of spironolactone, normally we start between 50 to 100 milligrams, and most patients are between 100 to 150 milligrams per day. Side effects include elevated potassium levels as well as swelling. So discuss with your dermatologist whether this treatment is suitable for you. Now, from there, you may consider cyclotron acetate. This can be used by some dermatologists, but spironolactone is preferred. Now, with cyclotron acetate, you can use that as a daily dose, but some of us prefer to use it in a 1 week per cycle, per month dose, repeated every month. In the US, I know a lot of my colleagues are using off-label treatments, so they include anti-androgens, such as finasteride or a dual blocker known as dutasteride. In Australia, I think most of us are much more conservative, but by all means, off-label treatments conducted safely can be an option. From there, we might consider PRP or platelet-rich plasma, and this can be injected into the scalp once a month for a series of between 3 to 4 sessions. From there, your dermatologist will probably space it out to 2 to 3 sessions between 3 to 6 months apart. This program, together with topicals and oral medication, will halt androgenic alopecia in the majority of cases, and in many cases, grow your hair. From there are other treatments, including low-level laser light therapy, together with thulium lasers. All of these treatments are known as adjunctive treatments. The end stage is that of a hair transplantation. It's a little bit more difficult in females because of the diffuse nature of hair loss. So discuss all these issues with your dermatologist to come up with effective solutions.